We do a lot of women's health care. Family physicians can do a lot of the routine screening care that women need, including pelvic exams, breast exams, screening for cervical and breast cancer, as well as screening for medical problems like high blood pressure, diabetes, high cholesterol, and we manage those as well. Sometimes when we do reproductive life planning, women are telling us, I don't want to be pregnant for the next 5 years, or I do want to be pregnant in the next year or so. So that may affect how we talk to them about what kinds of things they should be doing with their diet, with their general health, about what kinds of contraception might be ideal for them at that time. It's really important for us to talk about adolescents as well as with adult women. A lot of adolescents are thinking, well, I'm not going to be having a child for the next 10 years. But they may not be thinking in the sense of, I need the most effective way to prevent pregnancy if I am sexually active. It's important for parents to be able to talk to their children about these issues. We're happy as primary care providers to have those conversations with parents and children together, but we do also honor privacy and confidentiality for young patients if they present for these issues. Family physicians are often the point of entry to care for a lot of patients, and one of the things that we want to make sure that our patients have access to is contraception if they're interested in preventing pregnancy. It's really helpful for patients to have access to multiple methods of contraception, not just to be told, well, these are the pills that you're going to take and that's how you're going to take them, but rather to be presented with all the options because there are increasingly large numbers of options for patients. Delaware CAN, or Contraceptive Access Now, is a program where the state of Delaware partnered with a nonprofit called Upstream to train primary care and women's health providers across the state of Delaware in the use of all methods of contraception with a focus on the most effective methods, the IUDs and the implants. What we found is that women in a lot of areas outside of Wilmington and Newark often didn't have access to these most effective methods. The idea is that women can come to their primary care provider, to their family physician, to their nurse practitioner and say, this is something that I'm interested in. They don't have to necessarily wait for an appointment to see a specialist.